My name is Gagan Wig. I'm an associate professor in the School of Behavioral and Brain Sciences at the Center for Brain Longevity, based out of UT Dallas and UT Southwestern Medical Center. The current research we're working on is focused on understanding how brain networks change with age and understanding the lifestyle and health-related factors that might lead some people to be resilient to aging, whereas others are more vulnerable to age-related change. It's difficult to characterize an individual's exposures, but what we've done is we've looked at summary measures of socioeconomic status. So a big one that we look at is educational attainment and try to understand whether or not the presence of a college degree, for example, leads to differences in rates of change of brain networks in comparison to individuals who don't have a college degree. And what we're finding is that it does seem to be a marker of differences in change. Now, certainly college degree isn't, it's not simply the fact of having a diploma that's going to lead you to be protected to the exposures with age, but it's probably signaling something else, right? So what we're doing now is trying to understand the specific factors that are linked to environmental exposures that might accelerate the aging process. One big thing we're trying to do is increase the diversity of samples and representativeness of who we're studying. So historically, there has been limitations in who gets studied in aging research, but really specifically neuroimaging of aging. Classically, most of the participants in most studies, both large studies and also more targeted smaller studies, have been highly educated, wealthy, and white. So one of our emphasis is now to understand a broader spectrum of both income and race and ethnicity to better characterize some of the differences, because we think there's a lot to be learned from having more representative samples in terms of understanding age-related decline. So there's a basic science element, and that's to understand how we age and the brain changes that occur as we age. We have a specific approach for doing that. We think it's important to understand the brain as a large-scale network, because networks of the brain are what serve memory and attention and language. But there's also a clinical element, right? So we don't have that many biomarkers of age-related decline in health or in disease. So part of the motivation is to identify novel biomarkers of brain health. And ultimately the goal there would be to be able to use those both prognostically, but also just in terms of understanding how we're changing over time. And before we're able to identify things that might reverse those changes, we need to have the signal of those changes. We're trying to wed these different branches of science that span network science, neuroimaging, Alzheimer's disease and age-related diseases in general, but then also epidemiology, so understanding the life course exposures that might lead the brain to change. So it's really an attempt to bridge these multiple disciplines into a unified framework.